Hi guys, in this video we're going to talk about what makes the Gonstead adjustment different than say most other chiropractic adjustments. In the Gonstead work we're very precise, meaning we move a bone a very specific way according to how it's misaligned on the x-ray. So in most chiropractic offices, people are probably familiar with being laid on your back, face up, and the twisting motion of the neck. Well, that's a very common way to manipulate the cervical spine. It's very easy to learn, so that's why a lot of people do it, but there are drawbacks to it. Biomechanically, it's not the best thing for the neck. The way the neck is designed and the way the joints are, when you induce that much rotation, you can actually cause damage to certain parts of the vertebra. So Dr. Gonstead devised a very good way of adjusting the cervical spine that's really biomechanically correct, that doesn't damage the joints of the spine. It's done primarily here in the chair, and we adjust from back to front, or we call P to A, okay? So when we find a segment in the spine, and I've already done a previous video where we checked her, we've identified some areas that we're going to adjust. And for her, she has a 7th cervical here. And on the x-ray, there's not a lot of rotation in it, but it's slightly rotated to the left a little bit, and it's kind of got a little bit of a wedge on the left. So we would call that a PLS in the Gonstead listing system, which just means I'm going to adjust it from the left side that way, okay? I'm going to try to set that bone back up on top of its disc. But what we do here is patient relaxation is the most important thing. If she's tense, she's not going to adjust well. It's going to make my job very hard, and it won't be comfortable to her. So the first thing, we want to make sure she's positioned right, she's seated comfortably, she's not pushing on anything, she's doing good. The next thing we'll do, we're going to get on that vertebra precisely. I mean, I want to be on the exact inferior portion of the tip of that spinous on that left side. So I'm going to take a lot of care to find the segment, to get the tissue out of the way and get my hand in there. Okay, I'm on that vertebra. I have a good contact. And the next is a stabilization. I need to have total control of her head so that when I give my thrust, all that energy goes into the segment. So when I have her head here, I'm going to gently just bring her over a little bit. My stabilization hand's in place. And I'm going to bring it in nice and easy and give the thrust. Okay? Hopefully that was very comfortable to her. It moved very precisely, very cleanly. I didn't rattle the spine, meaning I didn't disturb segments above or below it. And that's what we're looking for. Because if we get in there and traumatize the whole region, just move a bunch of stuff, even though that may sound good, people may like the noise, it doesn't do the best thing for the joint. So that's what we do in the cervical chair. I hope you enjoyed it.